it is visible, right? And we can now go ahead. So before I go to the class, I just want to know from your people, that how many of you are aware of the what ABG. Okay, your awareness about the ABG. How many of you are aware of the ABG analysis? Not only the ABGs. I'm not asking if you know what is the full form of ABG. I'm just asking if you are aware of the normal ranges and analysis and the things which we usually must know. We usually must know when we are talking about the ABGs, right? So I'm just launching this poll. Just tell me how many of you are aware of the ABGs. Yes, guys. And how many are not aware of the ABGs? Yes, so many people are raising the hands also. Yes, very nice, very nice people, very nice guys, very nice, very nice. Oh my God. Guys, around 60% of you are not aware of the ABGs. But the best part is that 50%, around 40-45% are aware of the ABGs and ABG analysis. Perfect. Very well. Very nice. Very nice, guys. Very nice. So let's start. Okay. End of the poll, and you can see it is almost 50-50. Now it is 49 and 50%. Right? The people who know about ABG is 49%, and who are not aware of the ABG analysis are 51%. Okay, not a big deal. Let's not start. I mean, let's not go into that again. Okay. Perfect. Okay. So guys, today's class will be, having a lot of things. As you can see here, content of the masterclass, right? You can see in the notepad, right? Content of the masterclass. First, we will be covering what exactly the ABG is, major components of ABGs, and I'll be asking the questions as well. When we need the ABG test, and what is or what if we are taking the blood from vein instead of artery, and methods of ABG interpretations, and what are the 3 major questions we must ask ourselves when we are interpreting the ABGs. And then we'll be solving some problems. Not only these, but there are some typical problems as well. Okay, as you can see at the end of the page, this is just the page for ABG interpretations, and these are the simple problems, problem 1, 2, 3, 4. But there are 2 more problems. As you can see, problem number 1, that is very typical. And if I tell you now only what it will be the compensated ABGs. The problem 2 also will be the compensated ABGs. Okay, so we'll be discussing those things also, and you will be learning a lot, definitely, right? So let's start. What exactly is the ABG, right? What exactly is the ABG, right? So what do you think by ABG? We all know the arterial blood gases, right? What is arterial blood gases? Usually we have our RBCs, and we have other components in the blood, right? So the gases, okay, the gases, our RBCs and other blood components, majority by the RBCs. Okay, the blood gases majority by the RBCs are carrying. Okay, so those gases which are circulating through our circulation system, that is blood, to the different parts of the body. Okay, they are carrying the nutrition, they're carrying the oxygen, they are carrying the carbon dioxide, they're collecting back or to the organs. Those are from the circulatory system, and there are the normal values, right? There are the balances in the arterial blood gases, right? There are multiple things. So what usually happens is, let me tell you, there are 2 major components. If you understand, components means there are multiple components of ABGs, but when we talk about breathing, okay, when we talk about breathing, so there are 2 components, 2 major components. One is what? One is oxygen and one is carbon dioxide, right? One is oxygen and one is carbon dioxide. So what usually happens is our RBC is carrying the oxygen from the lungs to the entire body, and they are carrying the CO2 back to the lungs. So we can filter out the carbon dioxide and get the oxygen to purify the blood and to carry to the different organs, right? If this balance is not correct, right, if this balance gets imbalanced, right, what will happen? There will be many problems. There are multiple etiologies which can lead to the ABG imbalance, that can lead to the oxygen and carbon dioxide imbalance, and those are not only the problems, but those are the signs. Those are the signs of major problems in our body. Imbalance in the oxygen and carbon dioxide, very basic, I'm telling you. Imbalance in the oxygen and carbon dioxide are the major sign of the major problems, the bigger problems, the acute problems in our body, right? So we are talking about breathing here. So respiratory. Okay, one thing what initially and majorly we are talking about in ABG is respiratory part, where we are including the oxygen and carbon dioxide, right? The another part of the ABGs is when we are talking about bicarbonates. Okay, when we are talking about bicarbonates and the pH of the blood, pH of the ABGs, we check in the ABGs, right? The pH. So when we talk about bicarbonates are not related to respiratory. Okay, bicarbonates HCO3 are not related to respiratory system, but these are related to metabolic system. Okay, if I'm talking about metabolic, you must be thinking like what exactly it is in the basics. Metabolic means, see, there are multiple diseases related to metabolics. Like if I talk about DK, diabetic ketoacidosis, there are multiple other problems as well. And when we are talking about the respiratory problems, there is COPD, there is emphysema, there is pneumothorax, pneumonia, there are multiple other things which are related to the lungs, right? But when we are talking about metabolic, there are major problems as well. DKA, kidney problems, renal failure, okay, renal failure, heart failure. There are multiple other problems which are related to metabolic problems also. Okay, so there are few components, there are few major components which we can check or which we can test through the arterial blood gases, and those can tell us like where exactly the patient or patient's condition is leading. Okay, leading to like maybe the heart failure, to the kidney failure, to the maybe to the respiratory failure, to the end organ failure, to diabetic ketoacidosis, or multiple other things. These are the signs for the leading problems, right? These are the signs for the leading problems, and these are also the problems in itself. They have multiple complications, they have multiple etiologies, they have multiple causes. Okay, because these are not just happening simply, these are happening because of the trigger, by something else, right? So these things can be easily analyzed. Okay, so in ABGs there are multiple different components. Okay, let's discuss about the components of ABGs. Okay, what are the ABGs components usually we check in ABGs, guys? If you can write in that, can you please tell me what exactly we can check or we check in the ABGs? Please tell me, guys. Okay, PaO2. Okay, PaO2, and then what else? PaO2. Yes, guys. PaO2, PCO2. Okay, PCO2, SCO3. Okay. Okay. As I was talking about the oxygen. Okay. Oxygen is the first component, and when we go for ABGs, we cannot check the oxygen component directly. We check in two ways. One is saturated O2. Okay, one is PaO2, right? One is SaO2, one is PaO2. So SaO2 is not necessary to check by the ABGs. We can check it by the pulse oximeter also, right? We can check this by the pulse oximeter also. What is this exactly? This is saturated oxygen. Okay, oxygen levels. Okay, and how much it should be? How much the saturated oxygen level should be in the body? Guys, am I muted? Can you hear me, guys? Am I muted? I think you are muted. Someone is writing I'm muted. Not at all. You please check your side, guys. Okay. Okay. What is the normal level of SaO2? I'm talking about SaO2, saturated oxygen levels. So saturated oxygen levels always must be more than 94% to the normal. Usually, we consider, according to the ACC and the thoracic, International Thoracic Society, or the other American Thoracic Society, ATS, we consider it more than 94% SaO2. That we can check by two means. One is by the pulse oximeter, and another thing is by the ABGs. Okay. Second thing is, it is just one component. I'm talking about oxygen. Okay. This is partial pressure. This is partial pressure of oxygen. Okay, this is partial pressure oxygen. I'm so sorry for the writing because my right hand is restricted, it's not working well. I mean, there are, but it's okay. I mean, that's good. That's good. At least something we can write and we can talk and we can understand. So this PaO2 is partial pressure of oxygen. How much it should be, guys? How much it should be? Partial pressure of oxygen. Partial pressure of oxygen usually, partial pressure of oxygen usually, some societies and some authorities, some guidelines says it should be there. My electricity is troubling me. 70 to 100. People are writing percentage. This is not in percentage. This is in mmHg. PaO2, partial pressure. Guys, we are talking about pressure, not percentage, right? In YouTube also people are writing in percentage. No, this is not in percentage. This is partial pressure. This must be in mmHg. Some says this should be 75 to 100 mmHg. Some says this should be 80 to 100 mmHg. Okay, what? Your PaO2. PaO2 must be 75 to 100 mmHg. Some says 80 to 100 mmHg, right? And number two component here is, which is very important, just opposite to oxygen. What is that? Carbon dioxide, right? So in carbon dioxide also there is saturated carbon dioxide, but that's not useful. Pressure of carbon dioxide. What is the level of partial pressure of carbon dioxide? Can someone tell me? Yes. Can someone tell me? Definitely right. You guys are perfectly right. 35 to 45 mmHg. 35 to 45 mmHg, right? That is the partial pressure of carbon dioxide, right? I'll come to the next levels of this, the levels, but the normal level of PaCO2 must be 35 to 45 mmHg. Now, third very important component of this is bicarbonates. Bicarbonates. How much should be the bicarbonates? Bicarbonates and their units. Please tell me, guys. 20 to 20 what? What must be the bicarbonate levels? 22 to 26 mmol per liter. 22 to 26 mmol per liter, right? This should be the bicarbonates level. Dr. Sakin, are you here? Okay, she's here. Okay, great. I'm making you co-host, right? Guys, again, I'm so sorry. I lost the connection, but people here are really good. Huh? They, stopped me joining the class. Nice. Okay. So, anyways, I'm back. Right. So, where we were in the components of, components of ABGs. Correct. I hope now there'll be no problem. Yeah, there'll be no problem. I wish. Yeah. So the third part, what we are discussing about was bicarbonates. Okay. And I was just telling you why bicarbonates are very important and what exactly bicarbonates we check in ABG. See, bicarbonates are very important to maintain the hemodynamics. Okay. Maintain the hemodynamics of the body, of the circulatory system, of the organs, of the cells. Basically, in the cells, bicarbonates are the ions which maintain the ion gap. Okay, remember this statement, what I'm telling. Bicarbonates are important to maintain the ion gap in the cells. So these can maintain what? These can maintain the hemodynamics of the body. These can maintain the hemodynamics of our cells. That's why we need to check the bicarbonates, and bicarbonates are very important. Later I'll tell you when we are learning about the compensation phase of ABGs. When we are learning about the compensation phase of ABGs, I'll tell you how bicarbonates are very important and how these are the very important part of our ABG analysis, right? So these are basically there to maintain the hemodynamics of the cell, to maintain the ion gap in the cells, in the body, basically in the organs, right? Then now another very important part is very important and primary part, if I say, that is pH of the blood, pH of the cell, pH of the cell. If I'm telling pH of the blood, I'm telling. Okay, ABGs, we usually check the pH. So what exactly pH tell us? pH tell us about if the hemodynamics are alkaline or acidic, right? These two things only. pH tells us about the nature, about the environment, basically. If the pH is somewhere to the lower side, I'll tell the, yes, people are writing the normal levels also of the pH. So yes, pH tells us if the hemodynamics, if the environment of the cell, of the blood, of the body is alkaline or acidic, right? So pH normal level is 7.35 to 7.45. 7.35 to 7.45 is the normal level of pH, right? Normal level of pH. Now, the second thing what we wanted to discuss is, see, when we need the ABG test, when we need the ABG test, right? These are the just components. Now, the third thing is when we need the ABG test. Can someone tell me when we do ABG analysis? ABG analysis. When we do an ABG analysis, tell me, guys. Usually, we do the ABG analysis in acute conditions, okay, or acute on chronic conditions, acute on chronic conditions. And what are the basic indications? I'm not asking the disease. I'm not asking the disease. Okay. My question is very straight. When you see a patient, what do you see? Which reflects that you must go for the ABG analysis. You must do the ABG analysis. Okay. So asthma, ARDS, apnea, acute respiratory distress, yes. Yes, so first thing is problem, simple. In the simple layman language, problems related to the breath, right? Like shortness of breathing, apnea, hyperapnea, hypoapnea, whatever is there. Okay, these are the conditions we should check for PaO2, PaCO2, right? And SaO2, right? Whenever there are the problems related to breathing, either they are breathlessness, hyperapnea, hypoapnea, whatever is there, problems related to breath or problems related to metabolic distress. What is metabolic distress? What exactly is metabolic distress? Guys, just listen carefully. These are very important. Okay, basically when you see a patient, I'm not talking about, you cannot directly go to the heart failure, you cannot tell directly the patient is having heart failure or patient is having the asthma or something. You need to diagnose, but once you see the patient, what exactly you need to see, and that reflects like, okay, the patient must go for ABG. First is problems related to breath. Okay, respiratory related problems, either it is breathing difficulty, shortness of breath, or dyspnea, orthopnea, apnea, hyperapnea, hypoapnea, whatever is there. Okay, these are related to your breath. And the second thing is related to metabolic distress. Metabolic distress means, simple term, first thing is nausea, vomiting, okay, very extreme fatigue, okay. And then what else, history of fall, maybe, okay, history of fall or swaying, okay, or what whatever are the symptoms of hypoglycemia. What are the symptoms of hypoglycemia? What are the symptoms of hypoglycemia? Those kind of symptoms, nausea, vomiting, or we can say majorly the metabolic distress. Okay, wherever you see the sign and symptoms related to respiratory distress or metabolic distress, you must go for ABG analysis. You must go for ABG analysis, right? You have done the analysis. You have done the like testing, okay? Or I mean, you have seen the patients and you have decided like the patient must go for the ABG analysis. Now, the thing is, you have to send the blood. You have to send the blood. So blood can be taken from the artery or vein, right? So my question, very important question for all of you is, can we send the blood from the vein to check the ABG? Yes, guys, what do you think? Can we send the blood from the vein to check the ABG, arterial blood pressure, or sorry, arterial blood gases? Wow, people are saying no. Everyone is saying no. No. Okay. No. If we are sending the blood from the vein, what exactly it calls? Deoxygenated. Okay. Deoxygenated. But guys, in the similar conditions, let me tell you, that is the thing you have to learn. That is the thing you have to learn. For the same thing, for the pH, PO2, all the arterial blood gases and all the major components, if I'm asking you, we can check by both. We can take the blood from artery also, that is called ABG. If we are taking the blood from, what is this called as VBG, venous blood gases, okay. That's why I wrote artery versus vein. Okay, that's why I wrote artery versus vein. So what's the difference in artery versus vein? See, you will get the same thing. We can take the blood from vein also, okay. That will just change the name, because we are taking the blood from the vein. That's why it is called as venous blood gas, venous blood gases. Otherwise the purpose is same, and we can take the blood either from the artery or vein. Artery blood is quite tough to take. Remember what I'm, and listen carefully what I'm telling. Arterial blood is quite tough to take. Okay, because we have to find the artery, and arteries are deeper than veins. In our skin, when we are checking, arteries are not visible perfectly, usually in majority of the people. Okay, so it is struggling job when they take the blood from arteries. It is a struggling job, and we need special respiratory therapist and the specialist nurses to take the blood from arteries. Remember, respiratory therapist or the specialist nurses or specialist technologist, and everywhere, even in the bigger hospitals, these people are not available in the emergencies. So we usually take VBG, venous blood gases. And again, there are some disadvantages of taking the arterial blood gases, because there are the risk of multiple punctures, infections, hematoma. When we are puncturing the human being for the artery, it takes a lot of time, it takes a lot of efforts, and it can lead to hematoma, it can lead to multiple punctures, it can lead to the infections as well. Okay, acute infections. Okay, so that's why if you are taking the venous blood also, it is okay. What will be there? What will be there? What is the difference between arterial and venous blood? There is no difference. Only the thing is that there will be just, listen to or see, look at this, only 2% up and down and in PaO2 and PaCO2, only 2%. This is like only nearby, approximate 2% difference in PaO2 or PaCO2. You will be thinking that veins are having the deoxygenated blood. Yes, they have the deoxygenated blood, but the difference in oxygen and carbon dioxide content will be just approximately 2%, not more than 2%. Okay, so usually we can take the blood from the veins also. Understand? We can take the blood from the veins also, but we need the proper team. We need the proper people. Either they are respiratory therapists or specialized nurses, okay, or the blood technicians, the technicians who takes the blood, right? Laboratory technicians. There must be a specialist. Now the very important thing, if I am talking about the team, the emergency care of any patient, emergency care of any patient has multiple people, and ABG analysis is also related to multiple teams, multiple people, multiple healthcare stakeholders. First is definitely clinicians. In the clinicians means I'm talking about physician, right? Then anesthesiologist. Okay, anesthesiologist, they are more and most concerned about the ABGs. Then who else? Respiratory specialist, respiratory therapist. Okay, then nurses. Then who else? Then clinical pharmacist is the last component of this team. Okay, clinical pharmacist, but very important, because when it comes to the management, when it comes to the diagnosis, we need all these. When it comes to the technical part, we comes to the nurses. But when it comes to the management of alkalosis, management of respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis, we need to select the drugs. So clinical pharmacist is also, or the pharmacist is also a very important component of this team. Okay, whenever we are managing an emergency case, we need these people. Okay, so we have completed these things. What is ABG? Major components. When we need the ABG, arterial versus this. So now before we go to the ABG interpretations, we will learn about what are the major three questions we should ask ourselves, or whoever is analyzing the ABGs, what major three questions we must ask ourselves. Can someone tell me what exactly we look, or see, we can say them, the three questions or the goals of ABG analysis. Can someone tell me what are these things, these three things? Can someone tell me? What are these three questions? Anyone? Please tell me, guys. Yes. Okay, let me tell you. First thing is, if it is respiratory distress, if the distress is respiratory or metabolic. Okay, we have to find out either the distress is respiratory or metabolic. Okay, or we can keep this first, or this first doesn't matter. Okay, or the second thing is, or I mean the first or second thing is, either it is acidosis, okay, or alkalosis. Okay, either the environment or hemodynamic acidic or alkaline. So you can take this first or this first. These are the major two questions. Okay, and then the third very important thing is whether it is compensated or not. Okay, so we can divide it into three parts. One is non-compensated, means no compensation. Okay, no compensation. Partially compensation, or fully compensated, Now these are the three important things what we have to learn today. One is either it is acidic or alkalosis, either it is respiratory or metabolic. Okay, so let's see here. There are three methods. There are usually three methods, but one is very important. What usually these all are used by the nurses, because they are the major stakeholders who monitor the ABGs and who see the ABGs, right? So first, method number one, guys, method number one is Rome method. Okay, remember this Rome method, everyone. This is very important to understand the ABGs. You will understand it throughout. Okay, Rome method. Okay, what exactly the Rome method is? So ROME. Okay, ROME. Again, my electricity has gone. Hi. So am I audible? Am I audible? Because today this okay, great. That's okay. That's cool. Okay, so there is Rome method. Okay, today's I don't know how electricity is troubling. Rome method. So what exactly R is? If I'm talking about R is respiratory. Okay, R is respiratory. O is opposite. Okay, and when I'm talking about M is metabolic. And when I'm talking about suppose E is equal. Okay, Rome. Understand, I'll make it very simple for all of you. ABGs are very simple. Rome method, respiratory, opposite, metabolic, equal. So how do we read Rome? Rome is just to remember, otherwise we read it like ROME. Okay, ROME. So what is the pH. Okay, this is the pH. This is the pH graph, we can say. Okay, this is the pH graph, right? So here it is 7.35, here it is 7.45, and if I write in between here, that is 7.40. Okay, that is 7.40. 7.40 is called as absolutely normal pH. Okay, 7.40 is called as absolutely normal pH. If it goes like 7.41, 7.42, 7.43, 7.44, 7.45, and this side 7.34, sorry, 36, 7.37, 7.38, 7.39, right? And then 7.40. This is absolute normal. This is acidic. This side is acidic. The problem happens this side, means to the lower side, are called as acidosis, and the problem happens this side are called as alkalosis, because this is alkaline in nature. Higher pH is alkaline in nature, low pH is acidic in nature. So the things happen this side are called, the conditions are called acidosis, and this side, these are called as alkalosis. Understand? Very simple, very clear. Acidosis towards the normal side, the blow, to the lower side of pH, and alkalosis to the upper side of pH. Correct? And if you think, see, this is called as the entire thing is called as normal pH, but no, okay, this is the absolute normal. And if the pH goes to this side, if it is 7.43, 7.44, this is called as partial alkalosis. Okay, partial alkalosis. And similarly, this is called as partial acidosis. From where? From 7.40 to 7.36 is partial acidosis. From 7.41 to 7.45, that is partial alkalosis. And more than 7.5 is absolute alkalosis. And less than 7.35 is absolutely acidosis. Understand? Simple. Now the second component, if I come, what I'm telling is RO. Right? First component, the first thing of Rome is RO. If I'm telling respiratory is opposite, respiratory opposite of what? Opposite of pH. So this is nothing but what? This is nothing but what? What I'm going to write here? PaCO2. PaCO2. So PaCO2 would be just opposite to this. So what's the range of PaCO2, guys? 35 to 45 mmHg, right? 35 to, please stop me if I'm wrong, 35 to 45 mmHg, correct? And it is one more thing very easy to remember, 7.35 to 7.45, just remove the 7 and it comes 35 to 45 mmHg for PaCO2, correct? Right, guys? Understand? So when I'm talking about PaCO2, that is 35 to 45. And now, if I'm telling the first two words of Rome are RO. RO means respiratory opposite. So what is there? Downside or the lower side of pH is acidosis and upper side of pH is alkalosis. R means respiratory opposite. So if I'm talking about opposite part, what it will be? This side it is alkalosis and this side it is acidosis. Got it? PaCO2 respiratory. See, I told you when I'm talking about oxygen and carbon dioxide, that is respiratory. If I'm talking about bicarbonates, that is metabolic. Okay, so here respiratory opposite means if I'm talking about the lower side of RO, that is alkalosis, And if I'm talking about higher side of PaCO2, carbon dioxide, that is acidosis, right? Same thing with that, 35 to 45, 40 is absolute normal PaCO2, and if it goes this side, partial alkalosis. If it goes to higher side, partial acidosis. Got it or not? Now, the second part of Rome is ME, metabolic equal. What is metabolic equal means? See, simple thing, 22 to 26. What is the in between? 24, here 23, here 25. So this is the absolute normal of bicarbonates. Okay, this is the absolute normal of bicarbonates, and this is Me. Metabolic is equal to pH. Whatever pH says, it goes with that. Means this side it is acidic and this side it is alkalosis. Means alkaline, right? You understand the things. So 22 or lower than that is acidic condition and metabolic acidosis. Okay, you understand? Here, if we talk, that is respiratory alkalosis, respiratory acidosis. And if we are considering HCO2 bicarbonates, that is metabolic. Metabolic E is equal. Equal means the pH, whatever the pH stands for, same thing it will stand for, right? So metabolic acidosis is at the lower side, metabolic alkalosis is at the upper side. Now I'll come to that. Okay, so you understand what exactly the Rome is, guys? You understand what exactly the Rome is? Did you understand or not? Please tell me so we can go further. Great. Okay, now there is two things. Okay, where, see, first thing, if you tell the alkalosis or acidic, you can make out directly by looking at the pH if the condition is alkalosis or acidic. If we have to look for the respiratory, look at the PaCO2, right? If we have to look at the metabolic, look at what? Bicarbonates. Okay, three things very important. pH will tell you if it is acidosis or alkalosis. Then if it is respiratory, alkalosis or acidosis secondary, but if it is respiratory, look at the PaCO2. If it is metabolic, look at the bicarbonates. Or if look at the bicarbonates, if it is the discrepancy in the bicarbonates, then it will tell if it is metabolic. And if the discrepancy is in PaCO2, that will lead you to the respiratory distress. Understand? It's very simple. Now the second, this is the Rome system, this is the Rome method. The second method is very I think okay, so the second method is very important. Again, the taken care by, or the invented by the nurses for them. Okay, tic-tac-toe method. Okay, that is called as tic-tac-toe method. This is also like similar to Rome, or we can say that it is very simple to understand. Tic-tac-toe method. Okay, triple T method we call it, tic-tac-toe. So what they do is they just make the table. Okay, they just make the table. Okay, table, what is this? Three things we will write. What is three things? One is acidosis, one is normal, and one is, let's take red here, alkalosis. Okay, alkalosis. And they take two things, the three rows, three columns. So one row is for the names, and another two rows for the things. So this is pH. Okay, this is pH normal. Here if we say PaCO2 normal, right? PaCO2 normal. But if it is acidosis, then pH will be less and PaO2 will be high. If it is alkalosis, pH would be high and PaCO2 would be less. right? So let's understand it in the bigger picture. Let's understand it in the bigger picture. There are 6-7 steps, but I'll not take you through the 6-7 steps. You will be confused. It will be in the easy method. If I tell you in the easy method, see, okay, again I'll make the table. In this, first thing is condition. Okay, condition. What are the conditions? What are the conditions, guys? See, one is alkalosis, one is acidosis, one is respiratory, one is metabolic. So if we combined, what will be the probability of the things? One will be respiratory acidosis, one will be respiratory alkalosis. So we can fix this, then we can fix this, then there will be we can take some more space. Another thing is metabolic acidosis. You have to tell me this, okay? And then metabolic alkalosis, how it is, what it is, right? So let me just make it little more, right? So like that. Okay, I hope it is visible to all of you. Now what I'll keep here is I'll keep here the pH. Okay, then I'll keep here what? If you are thinking I'll keep PaCO2 or HCO3, not at all. I'll keep the primary problem. Okay, and secondary problem for your understanding. Secondary problem, right? Guys, understood? Okay, this is the table. How you will understand whether it's a respiratory acidosis, respiratory alkalosis. You understood that by the Rome also, but Rome just tells us like how it goes. Respiratory acidosis, I mean, if it is respiratory, then it would be opposite to pH. If it is metabolic, this would be opposite to, I mean, this will be equal to pH. So let's do the funda with that simple thing. If it is respiratory, what will be the pH? Respiratory. Okay, let's talk about acidosis. Okay, if it is acidosis, what will be the pH? Down. Acidosis, pH down. Alkalosis, pH up, right? Alkalosis, pH up. Correct. If I'm talking about respiratory, what will be the primary problem? Primary problem will be PaCO2. If I'm talking about respiratory things, primary problem is PaCO2. And if I'm talking about metabolic things, the primary problem is HCO3. Correct. Now tell me, and the secondary problem, again here secondary problem will be SCO3, right? And here the primary problem will be, I mean, HCO3, and secondary problem will be PaCO2. Now you will understand it easily by Rome method. See, pH, because it is acidosis, lower side. pH, lower side because acidosis. Either it is respiratory acidosis or metabolic acidosis. Acidosis means pH will be downside. Correct or not? Agreed? Yes. If it is respiratory, what it will be? Acidosis means PaCO2 will be high, and PaCO2 will be high if it is acidosis. If it is alkalosis, PaCO2 will be low, right? If it is alkalosis, PaCO2 will be low. In the metabolic acidosis, HCO3 is the condition. So if it is metabolic acidosis, HCO3 will be low, HCO3 will be high here. If it is alkalosis, HCO3 will be high here. If it is acidosis, HCO3 will be low here, right? And then in that condition, definitely it will be opposite. So what do you say? Understood, guys, or not? Tell me. By the Rome method only, I just have mixed the Rome method and tic-tac-toe method. Okay, all the tables. So it is very simple. I'll explain it again to all of you. It is very simple to understand. Like if it is alkalosis, respiratory alkalosis, or metabolic acidosis or metabolic alkalosis. Simple. pH will be at the lower side in acidosis. So either it is respiratory acidosis or metabolic acidosis. pH is low. pH will be high in alkalosis. Either it is respiratory alkalosis or metabolic alkalosis. pH is high. Okay, then if I'm talking about PaCO2 or HCO3, we cannot take the PaCO2 in one line or HCO3 in one line. We have to take what is the primary problem. See, why I'm taking the primary problem and secondary problem. We can keep HCO3 in one line, PaCO2 in one line, right? Partial carbon dioxide or bicarbonates in one line also. Why we are not talking? Because when we are talking about compensation, these things will struggle. That's why we have to divide it as a primary problem and secondary. Primary problem is breathing. Primary problem will be the levels, partial pressure of carbon dioxide. Okay, if I'm talking about metabolic conditions, the primary condition or the primary problem will be bicarbonates. Okay, so that's why I'm keeping it. Now I hope you understood that. Okay, and now I'll come to the compensation, guys. I'll come to the compensation. What exactly the compensation is, and you will understand it very easily. See, compensation means the imbalance of all these three. Okay, I'll take this color. Compensation, if I'm talking about, that means we don't know. See, compensation will be like if I'm talking about respiratory alkalosis. If I'm talking about respiratory alkalosis, what is compensation here? What is compensation here? See, PaCO2 will be extremely high. Okay, PaCO2 will be extremely high and pH will be extremely low in the normal state. If I say, normal state, it will be little variation. But if it is extreme, then PaCO2 will be very high and pH will be going really down. Okay, below the normal levels. So what happens in that case? HCO3. What HCO3 will do? HCO3 will not go down. Okay, if you are thinking here, I'm talking about respiratory acidosis, but in the respiratory acidosis, HCO3 will not go down at all. It will start going up. Why it will start going up? It will start going up. Why? Maybe it will not cross the normal levels, but it will go to the partial level high. HCO3 will go to the partial level high. Why? Just to bring back the pH to normal level. That is called compensation. Okay, that is called compensation. Okay, if it is like just a bit compensation, if the pH is in the upper levels, normal, but upper normal level or lower normal level. Try to understand what I'm saying. Please grab it. If the pH levels, if suppose I'm talking about respiratory acidosis, PaCO2 is very high and pH goes low, right? Not crossing the levels. pH is normal. Compensation comes only when pH is normal. Okay, listen to me what I'm saying. If it is normal respiratory acidosis, then pH will be lower side, PaCO2 will be higher side, HCO2 will be normal, but at the partial lower side. Okay, but if it is compensation, in that case, PaCO2 will be high, very high. HCO3 will also go high and pH level will be at the normal but lower side. Partial normal, partial low, partially low. It will show the partial acidosis. So why this partial acidosis? pH is normal, but why partial acidosis? Because HCO3 levels has gone to higher side just to compensate the pH, just to bring back the pH to normal level. That condition is called as compensation. In compensation, you will not see this table. Okay, you will not see this table. In compensation, everything will be messed up. Okay, in partial compensations, HCO3 will be at the partial higher side and the pH will be at the partial lower side. Okay, that is partial compensation. If pH is at the normal side, perfectly normal side, I mean little bit lower side, but HCO2 is at the, HCO2 is crossing the upper level. Now HCO2 is not in the higher normal, but crossing the higher normal. I mean, that is quite high. I mean, here PaCO2 is also high, HCO3 is also high, and pH is going to be normal, lower normal. Now it is called as fully compensated. Partially compensated means that HCO3 level will be at the higher side, but in the normal. pH will be in the lower side, but normal. That is called partial compensation. If means the HCO3 crosses the higher level, right, and pH is into the normal lower only, that means there was a very low, what we can say, the pH has gone literally low and HCO3 has gone high to stretch back the pH to the normal. That is fully compensated. That is called as fully compensated. Okay, and normal means HCO3 will be low, PaCO2 will be very high, and pH will be at the lower side. That is the normal. Or with all, not only the respiratory acidosis, but respiratory alkalosis. Respiratory alkalosis means pH will be at the higher normal, PaCO2 will be quite low, and HCO2, if it is in the normal higher level, normal lower level, it will be opposite always. Okay, normal lower level, that means partial compensated respiratory alkalosis. But HCO3 are too low, pH is quite high, but into the normal, and PaCO2 is quite low, then it is compensated, fully compensated respiratory alkalosis. It goes with all. Try to understand again. It goes very well. Okay, this will be in the compensated things. Either this will be at the above or lower normal side. If it is above or lower normal side, that is partial compensated. If it is totally opposite, okay, totally opposite, above or lower, totally opposite. Okay, if it is upside, it will go to, HCO2, it will go to upside, or PaCO2 will be going to lower side. If this secondary problem, I'm talking about secondary problem, if the secondary problem is totally opposite, that means there is a compensation of getting the pH to the normal level. Understand? That is the compensation level, and compensation is quite dangerous. Compensation is the acute failure of the liver, kidney, heart, or multiple functions. Okay, multiple organ failure. Okay, that is multiple organ failure, right? That is the PaCO2 and PaHO2. Okay, that is the normal thing. How do we analyze and how do we interpret the ABGs? Okay, understand, guys? This is very simple. Now the thing is, we will just solve some problems. Okay, we will just solve some problems. Please tell me, I'm asking you, and then we'll go to the major problems. 10 more minutes, and then there is very important thing. What are the major reasons, etiologies for respiratory alkalosis, respiratory acidosis, metabolic acidosis, metabolic disease is not enough. I can take it in the other class also, but I'll tell you the brief, like how to correct these things. What are the exactly, reason behind happening the alkalosis and acidosis? Okay, now you understood the ABG. Now you understood how to lead, how to get the proper result of alkalosis or acidosis, or if it is respiratory distress or metabolic distress. Okay, I'll tell you what are the metabolic conditions also. I'll tell you what are the respiratory conditions also, and how you will get those things, right? So first, let's solve some problems, and 15 more minutes it will be there. So tell me, what exactly do you understand by the problem number 1? what exactly the patient is in currently. Yes, if I write ROME, patient number 1. Respiratory acidosis. pH is 7.28. 7.28 means acidosis, right? Acidosis. CO2 is HCO3 is normal. HCO3 is normal. So the patient is normally in respiratory acidosis. Respiratory acidosis, correct? Respiratory acidosis. Okay, respiratory acidosis. Respiratory acidosis. Why respiratory acidosis? Because CO2 is at the higher side, pH is at the lower side. Look at the table. Look at the table. Look at this table. Look at this table. This table only. Look at this table. pH at the lower side and PaCO2 is at the higher side. HCO3 is normal. Okay, so that is purely respiratory acidosis. Okay, now the problem number 2. Can someone tell me? Can someone solve me the problem number 2? Yes, guys, YouTube people also, please tell me. I'm looking at your comments. Yes, respiratory acidosis written by Bhumi. Yes, I'm looking at your comments also, guys. Please tell me. Number 2. Problem number 2. What exactly is the problem number 2? Yes. Problem number 2, guys. Oh no, right? Why? How can you say that it is compensated? Come on, yaar. This is metabolic acidosis. This is very simple problems. These are very simple problems to understand. Okay, these are very simple problems to understand. Okay, these are not the major problems. These two are not the major problems. Okay, so this is nothing but metabolic acidosis. Why it is metabolic acidosis? Look at the pH. Lower side means acidosis. Lower side means acidosis. CO2 is normal. HCO2 is at the lower side. So if both are lower side, that means metabolic acidosis. Metabolic acidosis. For one side, that is respiratory 7.42. Guys, this is quite, you have to understand. Okay, you have to tell me. pH is 7.28, sorry, 7.42. CO2 is 26. HCO3 is 18. Yes. Okay. Okay. Got it. Got it, guys. You guys are rocking. Okay. So let's do it. Let's do it together. Let's do it together. Okay. Let's understand. So everyone can understand it easily. 7.42. Okay. It is at the higher upper side. Higher upper side. pH is normal. pH is normal, but at the higher upper side. So we can say this is not partial. I'll not write partial here. Okay. I'll not write partial here. Partial, writing partial is, we will be partial otherwise. Writing partial is not the correct thing here. Okay, I'm so sorry. No partial. Okay. Alkalosis. Understand? Alkalosis, right? Now look at the CO2. What exactly the CO2 says? 26. 26. It should be less than, I mean, it is less than 35, right? It is less than 35/26. So it is respiratory. Respiratory, right? Respiratory alkalosis. Now, look at the HCO3. Look at the HCO3 bicarbonate. It is very, very less than 24, right? It is very, very less than 22, right? It is very, very less than 22. So what it says that HCO3 here is compensating the pH. Okay, it is compensating the pH, right? And so what we will say it, and this is lower than normal. So what we will say it, this is compensated respiratory alkalosis. Okay, this is compensated respiratory alkalosis. And what is this, guys? What is this? Sorry, partially compensated. This is partial compensated. Sorry, yes, partially compensated. This is partially compensated because pH is also into the normal side. What exactly is this second thing? Yes, guys, what is second thing? What is second thing? Yes, people from YouTube also can answer. Yes, what is number 4? Is it my voice is breaking? Is it? Okay, great. Tell me what exactly the HCO3 here is. What exactly the problem number 4 says. Yes. Okay, look at this. This is again alkalosis. Okay, this is again alkalosis. CO2 here is just higher. It is just higher than 45, but HCO3 is quite higher. Okay, so the primary problem here it comes is metabolic. Okay, primary problem here is metabolic, not the respiratory. Respiratory is compensating pH, but not completely. So this is fully compensated metabolic alkalosis. Fully compensated metabolic alkalosis. Fully compensated metabolic alkalosis. Okay, fully compensated metabolic alkalosis. Now, 2 more problems for you. Very simple. I mean, quite tough, but yes, these are with the problems. Okay, these are with the answers. Now you have to tell me, patient number 1, I mean the patient has the following arterial blood gases results. pH is 7.43, PaCO2 is 28, HCO3 is 18. This is known as partially compensated respiratory alkalosis, fully compensated metabolic acidosis, partially compensated respiratory acidosis, or fully compensated respiratory alkalosis. Tell me guys, what exactly is this? Yes, problem number 1, guys. Problem number 1. Okay, I told you these are quite complicated problems. Every answer till now is wrong. A and B. Okay, 50-50. I'll give you the 50-50, right? Low by 50-50 lifeline is there. Now tell me, guys, 50-50 lifeline is gone. The answer is from either C or D. Answer is either C or D. This is your 50-50 lifeline. Oh no, still I don't understand because everyone is writing C, D, C, D, C, D. Okay, let's analyze. One by one, tell me. One by one, okay? One by one, tell me what the pH 7.3 says. It is alkalosis. Alkalosis, right? Alkalosis. PaCO2 is 28. So what it says? again it says alkalosis, right? It says alkalosis because it is lesser than 35, right? It is lesser than 35, so it is alkalosis. PaCO2. Now look at the HCO3 is 18. This is again less than 22, right? Less than 22. So how you will define the condition? How you will define the condition? If it is plus minus 2% or 4% or 8%, look at the percentage. Okay, from the 35 to 28, it is quite high percentage. So the condition is definitely the primary problem is respiratory, not the metabolic. Okay, primary problem, we have to find out the primary problem here. So primary problem is respiratory, not the metabolic. Okay, that's why I told you, look at the primary problem and secondary problem, which is more, considerating here. PaCO2 is 28, quite lesser than 35, right, in comparison to the metabolic bicarbonates. So this is alkalosis respiratory. Now look at the pH and look at the compensation factor. If it is respiratory alkalosis, then what is the compensating factor? HCO3. If HCO3 is normal level like 22 or 23 or 24, like lower side, then we can say it partial compensation. But if the HCO3 is completely lower than the normal, then it is fully compensated to compensate the pH. Okay, fully compensated. So the answer is D, fully compensated respiratory alkalosis, because the compensation factor, as I have written there, the correction factor is quite lesser than the normal value or quite higher than the normal value. If the correction factor is quite lower or higher than the normal value, then it is fully compensated, right? So the patient is fully compensated. If I write here, fully compensated respiratory alkalosis. Understand? Fully compensated respiratory alkalosis, right? Now let's come to the problem number 2. This is the last problem, and then we'll just understand the fact and these 4 components, and then we'll keep off. Okay. A patient has the following arterial blood gas results: pH 7.37, PaCO2 33, and HCO3 is 17. So what would you think, guys? Like, first tell me, let's understand. pH is 7.37, normal side but lower. So we can say this is acidosis. Okay. I mean, first tell me your answer. A, B, C, D. What is your answer in that? Yes, guys. Look at this. What is your answer? Perfect. This time answer is perfect. Fully compensated metabolic acidosis. Fully compensated metabolic acidosis. Yes. Why it is? Because see, this is acidosis. Yes. PaCO2 is not the primary concern here. PaCO2 is not a primary problem because 17 is quite lesser than 22, right? So primary problem is metabolic, right? Primary problem is metabolic acidosis, and PaCO2 is compensating for that. It is 33. It is also not somewhere between 35 to 45. So it is going lower to compensate that. So this is called as fully compensated, the B, fully compensated metabolic acidosis. Fully compensated metabolic acidosis. So I hope, guys, you understood. Okay, I hope you understood how to do that, how to check that. Okay, I hope you understand. I hope you understand that what exactly is these conditions. So please tell me, please write if you understood what is ABG and how to define acidosis, alkalosis, and how to define if it is respiratory or metabolic. These are the major implications of ABGs. Guys, please tell me if you understood or not. If you have any queries, we will open the mic and we will learn about that. Okay, we will learn about that. So I tried to simplify the ABGs for you today. Okay, and how to interpret those things into alkalosis, acidosis, metabolic, respiratory, whatever it is, I try to try to do that. Now I have another thing for all of you. Now I have another thing for all of you, which is like again the interpretations. Okay, interpretations. Okay, where is that? So sorry, one sec. Yes, it's just yes. So first we will start with these balances. First is respiratory acidosis. Let's take first respiratory acidosis. So what exactly the respiratory acidosis is? We got to know respiratory acidosis means the pH will be at the lower side and PaO2 will be at the upper side, right? Acidosis, PaO2 will be at the PaCO2 will be at the upper side. So what are the types of respiratory acidosis, guys? There are two types of respiratory acidosis. Okay, I'll not take much, but it is very important to understand what is respiratory acidosis, how to correct it, and how to implicate the other things. Respiratory acidosis, there are two types. One is acute, okay, one is chronic. One is chronic. So acute is like which is occurring immediately, and acute is life threatening. Okay, acute is life threatening, right? And chronic is not life threatening. Chronic develops slowly, and it develops with the slow rate diseases like asthma, COPD. Okay, and acute appears in cases of acute this is respiratory distress. So it will be related to respiratory problems only. Understand, it will be related to respiratory problems only. So in case of emphysema or exacerbation of COPD or pneumonia, pneumothorax, or maybe in pulmonary edemas, okay, you will see the respiratory acidosis in acute conditions. Okay, and what are the risk factors usually for that? Respiratory conditions like pneumothorax, as I told, pneumonia, exacerbation of your COPD. And another thing is the risk factors: hypoventilation. Okay, hypoventilation, sorry, this is ventilation. Okay, hypoventilation is the major cause for respiratory acidosis. Okay, hyperventilation, how the hyperventilation happens actually, that can happen in case of brain injuries. Okay, that can happen in road accidents, RTAs, road traffic accidents. Okay, that can happen in seizures. Okay, that can happen in related to anxiety also, right? So hypoventilation, I mean, hypoventilation does not mean that you are just in the locked room, but hypoventilation does mean that your brain cells are not getting the proper oxygen levels, right? So hypothyroidism can cause this, or maybe hypoventilation can cause this, myxoedema can cause this, brain trauma, coma, road traffic accidents, RTAs, majority of these cases can get into this. And then third very important reason for a respiratory acidosis, guys, is nothing else but drugs. Okay, drugs like heroin, fentanyls, or magnesium sulfate, morphine, or tramadol. Sometimes these drugs can affect very much on your respiratory system and cause the respiratory distress. Okay, these causes the respiratory distress, right? So sorry, I think something happened to my computer. Okay, so these causes the problems, right? What are the signs and symptoms of respiratory acidosis? First of all, if the patient is in respiratory acidosis, I told the symptoms will be related to, like, you get in the hypoglycemia, right? In the hypoglycemias, like altered level of consciousness, maybe the confusion, disorientation, coma, tremors, these kind of things will happen when you will get the respiratory acidosis. Okay, when you will get the respiratory acidosis. What are the managements? Definitely medications in obese patients, weight loss, and the urgent care is the ventilation, mechanical ventilation. Okay, urgent care is mechanical ventilation, and we should look for the hyperkalemia also, because that can lead to the extracellular fluids, and this can lead to the proper fluid accumulation in the body, and that can again lead to the further problems, right? Then the second thing is respiratory alkalosis. So respiratory alkalosis happens with hyperventilation. Okay, and if the patient comes into the panic, okay, sometimes it can happen because of the panic also, or the severe high grade fever called as hyperthermia. Okay, so alkalosis happens in when your hemodynamics gets completely imbalanced and your pH goes high. So pH goes high in certain conditions like high grade fever, hyperthermia, panic attacks, or brain damage. Again, it can happen, or maybe the decay also. The diabetic ketoacidosis also faces the risk of respiratory alkalosis. Okay, and then sometimes progesterones in the women during the pregnancy can cause the respiratory alkalosis. Okay, and then sign and symptoms are totally opposite to the respiratory acidosis. Here it is numbness, tingling sensation, and hypocalcemia, right? These could be the symptoms, or the seizures kind of symptoms. These could be the symptoms of respiratory alkalosis. Okay, and management, again, the some medications or the safety, and the oxygenation if it is needed, the oxygen, right? If it comes to the metabolic acidosis, the first risk factor of metabolic acidosis is diabetic ketoacidosis. Okay, diabetic ketoacidosis leads to the metabolic acidosis directly, and the other problems are obesity, diarrhea, dehydration, kidney disorders. These are the major problems what you can detect by the metabolic acidosis. Okay, and sometimes the toxicities of the drugs. Signs and symptoms, again like the acidosis, disorientation, altered sensation, confusion, coma, lack of appetite. Sometimes like acidosis has the same symptoms, either it is respiratory or metabolic. Okay, management, sodium bicarbonate could compensate for so. Okay, and maybe sometimes the diet. And in symptoms are like the Oh, I think again I lost my voice for some time. Okay, so I was just telling about that either it is a metabolic acidosis or metabolic alkalosis. I mean, the acidosis and alkalosis. Acidosis has the similar symptoms. Acidosis, both respiratory or metabolic, has the similar symptoms like disorientation, confusion, coma, altered level of consciousness. Okay, and if it is alkalosis, then the symptoms are similar: numbness, vomiting, diarrhea, and seizure. Okay, and it can get to the fatigue or coma also sometimes, right? So these are the major things what you must learn from these, and you can read some more. And guys, this is just the I must say, this is just the demo class of the